Now you're watching TVC News. We've been following the outbreak of the coronavirus in parts of the country, and we also have been reporting that 10 more cases have been reported, 7 in Lagos and 3 in Abuja. Right now we have Dr. Ada Ikeako joining us now from Abuja to talk about how we can protect ourselves from COVID-19. She will also be talking about how to reduce anxiety, panic, and importantly, demystifying the myth around COVID-19. Dr. Ikeako, it's good to have you join me right now. Let's begin. You are joining us from Abuja, and we hear the Minister of FCT saying that they are doing everything possible to prepare for any eventuality. How prepared or ready is the medical system or health system for coronavirus in Abuja?
Yes, I think that, a lot of preparation is being made. They've shut down all airports as of Monday. They now have some patients at Abuja University Teaching Hospital. They have isolation beds there. And the question is whether to create additional isolation beds at other hospitals as well.
All right, now we have, there has been awareness campaigns going out all the while from the media, from the Ministry of Health, the NCDC, even churches and mosques have been reaching out. But yet we still have this virus spreading amongst the people. What are the people not doing rightly, or why do we still have these cases if the people are adhering to some of these instructions?
I mean, the thing is, you have asymptomatic carriers. So those are people that have the virus, but they don't have any symptoms, yet they can spread the virus to other people, and I think, when you have that, occurring, then there's no way of knowing who it is that has the virus and who doesn't have the virus. So the thing is, we're going to have to screen a lot more people. And in so doing, we have to practice social distancing, shutting down non-essential services, businesses, schools have been closed as of Monday, which is definitely a step in the right direction. But we have to go further, in terms of businesses and non-essential services shutting down completely.
All right, we see government taking drastic measures to curb the spread or continuous escalation of the virus. And they have one statement they always use is there's no need to panic. Is it possible to hear that schools are closing, churches are closing, mosques are closing, and yet not panicking? Can you talk to us about that?
Well, a level of anxiety is normal. It's protective. It's what tells your body that you have to prepare and get ready and solve problems. But when it's excessive, then it can cause stress. Chronic stress can lead to depression. It can affect your ability to function and carry out your daily tasks. So what we're talking about is not healthy anxiety, but when it comes to hysteria, paranoia, and a complete shutdown of your ability to function on a day-to-day level.
All right, even the United States, as at now, is complaining of not having enough test kits. It's the same thing in the United Kingdom, it's the same thing in France or Italy or Germany and countries around the world. For us here in Nigeria, I wonder how much of that is available or unavailable.
Well, we have to go with what we have, which is universal precaution. So wash your hands frequently for at least 20 seconds, several times during the day. Clean high contact surfaces. If you don't have water and soap, then you should use alcohol rub. Social distancing, shutting down non-essential services completely, not just schools and airports. We have to go further than that so that we can break the cycle from asymptomatic carriers. So we will do the best we can, but I think we can do a lot with what we have.
All right, Dr. Ada Ikeako, thank you very much for talking to us on TVC News.